Hi everyone, my name is Ryan Halabi, and the One Health seminar topic I have selected to present on is Lyme disease. So let's get started with some background information on what the One Health concept is, along with some key terminology first. So the One Health concept basically converges human, animal, and environmental interactions in an effort to optimize health outcomes across all three of these domains. It emphasizes cooperation and collaboration across disciplines, with specific emphasis placed on the interrelationships between the fields of medicine, veterinary medicine, and environmental health. These joint collaborations include educational initiatives and measures aimed at prevention, management, and the control of diseases. So some key terminology first. Let's start with public health. Public health is the science and art of preventing disease, prolonging life, and promoting human health through organized efforts and informed choices of society. It also includes public and private organizations, communities, and individuals. Public health aims to improve the quality of life through prevention and treatment of diseases, including mental health, and this is done through the surveillance of cases and health indicators, and through the promotion of healthy lifestyle behaviors. So the key points of public health is that it's interdisciplinary, it conducts translational research, and it collaborates across many different disciplines. There's advanced knowledge and health education and promotion that's developed from this, and there's also engagement of community-based practices. It also develops, implements, and evaluates health promotion programs and assesses health needs in a community and within communities. So moving on now to zoonosis, as we've learned in class, a zoonotic disease is any infectious disease that is able to be transmitted in some instances by a vector from vertebrate animals, both wild and domestic, to humans. So equipped with this background knowledge, now we can gain a better appreciation for what Lyme disease is and how it spreads and how it's managed. So it's just a little figure of Lyme disease. Those are the ticks that carry Lyme disease and transmit it to humans. So Lyme disease is a zoonotic disease that's caused by the bacteria Borrelia burgdorferi and is transmitted to humans via a vector bite from an infected tick. A little background on this disease is that it is a zoonotic disease that's a growing public health threat. As you can see, it affects a lot of regions in the US and Canada as well, but this is just a map of the US specifically here. It is endemic to the upper Midwestern and Northeastern US, with over 300,000 cases diagnosed annually in the US, and that's just people that show up to the emergency department or see their public health practitioner. There's a lot of undiagnosed cases because people don't show up or, end up staying asymptomatic. So reforestation and suburbanization have played a key role in contributing to the emergence of Lyme disease in the U.S. and have also been responsible for its continuously expanding niche in the northeastern U.S. So the transmission of Lyme disease. So it's transmitted through the bite of infected ticks, as I've discussed earlier. So the black-legged tick or deer tick, Ixodes scapularis, spreads the disease in northeastern, mid-Atlantic, and north-central U.S. The western black-legged tick, which is Ixodes pacificus, spreads the disease on the Pacific coast. Its reservoir includes small rodents such as mice and white-tailed deer. So the ticks will attach to any part of the human body. They're often in hard-to-see places such as the groin, armpits, or scalp. And in most cases, the tick needs to be attached for 36 to 48 hours, so approximately 2 days before the bacteria is transmitted. So if you remove it before then, for the most part, you don't end up getting Lyme disease. So what are some of the signs and symptoms? So you can see there's a lot of different signs and symptoms that develop due to Lyme disease, and they're in different frequencies, but the clinical manifestations are categorized into 3 stages. An early localized stage, which happens hours to days post-tick bite, and it includes a distinctive rash and flu-like symptoms. A distinctive rash is a bullseye target type rash, which you'll see in one of the images coming up, with some flu-like symptoms. The early disseminated stage, which is stage 2, happens weeks post-tick bite, and that can consist of cutaneous, cardiological, and neurological symptoms. And finally, the late disseminated stage, which happens months to years after tick bite, consists of neurological and rheumatological manifestations. Thus, if left untreated, the manifestations of Lyme disease can result in significant morbidity and mortality. And as the longer you go untreated carrying Lyme disease, the more likely you're going to have a severe complication or mortality from it. Okay. So what are some of the risk factors and some of the high-risk groups? So this is really split into four major categories. So there's the spatial, which is just the geography. I've highlighted some of the areas in the US and Canada that it's endemic to. It's seasonal, so it's temporal, meaning the springtime, the summertime is usually when you're at highest risk, especially if you're outdoors. So that's the next category. Recreational outdoor activities, if you like to hike, if you like to camp. Go outdoor, enjoy outdoor water sports, or go camping, especially in wooded areas. These sort of things increases your susceptibility to Lyme disease. And finally, age. The youth group tends to be the most susceptible. But that could just go hand in hand, kind of with activities when it comes to outdoor activities and things of that nature. So the diagnosis. So it's normally a clinical diagnosis with serology used for confirmation. So the big key here is just early diagnosis and treatment, and that consists of a history of presenting illness, including risk factors and clinical signs and symptoms. And for confirmation, you can use serology such as ELISA and Western blot techniques. Treatment centers on an antibiotic regimen, and that's usually specific to the stage of the disease, which is another reason why the clinical history is important. So ceftriaxone is usually used in the second or third stages because it crosses the blood-brain barrier. As mentioned earlier, Lyme disease in the second and third stages can have some neurological manifestations, so it goes to your head. And ceftriaxone can follow it into the brain area to get rid of the infection. Some of the complications of Lyme disease include cognitive deficits, facial paralysis, hearing loss, chronic arthritis, and some heart rhythm irregularities. The image on the screen, the leftmost image shows you that bullseye target rash that I was speaking about earlier, and that's usually the first sign of Lyme disease in the first stage. It could also be a complication along with the others listed here. So prevention strategies. The control of Lyme disease is multifaceted and includes avoidance of tick-infested areas, the usage of insect repellents, performing daily checks for and removing ticks promptly. As I noted earlier, it takes about 36 hours before the disease is transmitted. So even if you had a tick stuck on you for 12 hours, 13 hours, and you notice it and you remove it properly, odds are you will not be developing the disease. Also, educating the public on the signs and symptoms of Lyme disease in order to promptly recognize and seek early treatment, applying pesticides, and reducing the tick habitat. So case management here. So this is just an algorithm, this screen and the next screen, picked up on how to manage Lyme disease. So I'll summarize it a little bit. So how do we manage Lyme disease when a patient is suspected of contracting it and shows up to the hospital? So first and foremost is taking a thorough history, which includes review systems and physical examination. The history should include for risk factors discussed earlier, such as outdoor activity or travel, close contacts diagnosed with Lyme recently, exposure to rodents, and spatial and seasonal information. You also want to establish a timeline, as that's essential because it helps determine which stage of the disease process the patient is in, and this will also guide your therapeutic measures. Next, signs and symptoms, particularly the hallmark bullseye target rash as seen in the figure earlier, is something to be looking for when someone shows up to your hospital and is suspected of having Lyme disease. Physical examination is important, so you can look for those signs and symptoms, including target rash at that point. But also, if you find an engorged tick, you want to remove it, and you need to remove it carefully because you can't just pluck it off. If you do that, the patient could still have Lyme disease as you haven't removed it properly. Okay, so to confirm, you can do lab testing with ELISA and Western blotting. However, if you suspect somebody of having Lyme disease, so you find an engorged tick that's been on the patient for days, or you see the bullseye target rash or whatnot, you start antibiotics based on the clinical presentation, and then you can wait for laboratory testing to come back and decide if you want to continue or discontinue the treatment. So the treatment is antibiotics and follow-up, which is key because you want to ensure that the antibiotics are working, as well as you want to track any potential complications down the line and make sure that you have them under control. So tying this back into the One Health concept, so we talked about medicine, veterinary medicine, and environmental health. So how does Lyme disease and its factors fall into these categories? Well, in medicine, you need to develop some health education and promotion so people can understand the risk factors associated with Lyme disease, as well as picking it up early and seeking treatment. So early recognition and treatment, health education and promotion. For veterinary medicine, it includes pets, vectors and reservoirs, and surveillance and tracking. So we spoke about some of the vectors and reservoirs earlier. You also want to have surveillance in place and tracking, because if you see that it's prevalent and higher than normal numbers, then there's an underlying issue there, and you might have to delve a little further to find out why this specific time in this year it's more than what's expected, and then you can resort to measures to combat that issue. And environmental health, which includes the ecological niche, the habitat protection, reforestation, and suburbanization. So these are all important because these are factors that could expand the niche for Lyme disease. So if you take care of your habitat, if you put environmental measures in place and you keep the environment healthy, you're likely to reduce the niche, and with that, the prevalence of Lyme disease. So these are just some references. So thank you guys for listening to this presentation. I hope it was informative and insightful, and I look forward to watching some of yours. Thank you.